what do we know about the potential impact of the vaccine on children in that young adults, that 18 to say 25, because they're still, they're still developing in some ways.
So their immune systems are fully mature. Pretty much once you're 12, the way your body fights infection, it's fully functioning. The vaccine works very well in young, healthy adults. And, Pfizer, 95% effective, Moderna, 94.1% effective. So they're great. Pfizer's approved for people as young as 16, Moderna as young as 18. And there are trials ongoing right now. And I would bet you sometime this summer, the vaccine will be available for children under 16.
Which of the vaccines are being tested on children? And from what age range to what age range?
Whole bunch of kids, I believe, over 2 years of age for Pfizer and Moderna. And then there's other vaccines that will likely be approved in the country in the near future. Johnson & Johnson has one. They're doing pediatric trials as well. So we're a few months away before we're going to see what that data looks like. But I do believe we'll be able to give the vaccine to just about everybody will be eligible by the fall.
Elisa, could you tell us right now at TCF, what are the age ranges that you eventually do anticipate? So if I show up with someone who is 80 years old and in the car with me is someone who is 30, but has comorbidities, would they be eligible to receive the shot?
So currently we have seen folks from different ages come in and receive the vaccine. You have to be 18 and older. That was per our guidelines. So if you are a food service employee that's 25 and work in the city or live in the city, you would qualify to get the vaccine. So we have made those standards here.
So we all know about the history of the Tuskegee experiment, but that's just a blimp in actually a long continuum of lots of things, not to mention the health disparities and the biases that Black and Brown people encounter when they encounter the health system. So now, how is your institution specifically trying to address those issues of racial and ethnic disparity? How are you trying to make sure, one, your process is more equitable and inclusive? And in what ways are you including Black folk and Latinx and other communities in being out in the community to work and inform the community?
Part of the partnership we've had with a couple of churches, they have been predominantly African-American churches, so it's great we can be there. Myself and a few of my colleagues, I'm losing track of how many of these sessions we've been given, it's not a complaint by any means. We want to give people the information. Everyone here is a smart person. I will share the facts as I know them for people to make their own decisions. We are tracking ethnicity of people when we vaccinate them. We are very much cognizant that we want to make sure that some of the groups that are really at the most risk for COVID complicated illnesses and death get the vaccine, which in many cases are minorities. And Henry Ford's also committed to the state of Detroit, which is why one of our vaccination centers is downtown at One Ford Place, excuse me.
From the city's aspect, I mean, our number one, we had a few goals, but our first goal was to make sure everyone had access to the vaccine. So the way that we did that was just providing one phone number so people could call and make an appointment, and then have a central location, but then also set up the churches and work with the clergy and the bishops and the pastors, and then go into the community with the senior living homes, and get out there and have more of these panel discussions. I know a lot of the members from the health department have been talking to different community members, educating them. And I think this is what you all are doing today is really critical. And then on site, an important thing is that we provide a transportation to the site. It's $2 for residents. So they will come pick you up, bring you to the site, and then take you back home. We also have ASL translators from our laptops. So if someone comes in and needs one, we can get that done right away. We also have a hotline on site that if someone comes in and speaks a different language, we have about 50 options that people can point to, get a translator on the phone. And then we also have all of our documents that you receive post-appointment translated in Spanish, Bengali, and Arabic. And then if there's another request, we can get that to you. And we also have them in Braille as well.
We're in our 51st year of providing health and wellness services to the community. And from the very, very, very beginning of the pandemic, we've put forth extraordinary efforts to make sure that, one, we stay open, two, that we continue to meet all the needs, not just the COVID needs for our community, advocating for us to have been able to get and continue to do the COVID testing, and to advocate for our community to be able to get the vaccine. And we're starting, we're starting to get that, to continue to provide the best care that we can to everybody in the community. We're partnered with our community based organizations to make sure that we're on the same page in the education space, providing information here on the COVID313, our social media, partnering with the health department as well as with Henry Ford to make sure that we're leveraging all the resources without duplicating or stepping on each other's toes, to make sure that all of the necessary resources for our community are here and made available to anybody that needs them.
Somebody said that I had COVID and now I'm afraid of getting the vaccine. What do you suggest that I do?
I would recommend they get the vaccine. And the reason for that is there's some data out now that the protection from the vaccine is likely going to last longer than the protection you get after being infected. It won't hurt you. Just because you had COVID before, the vaccine's not going to hurt you. The only thing it may do is make your immune response better.
The last question is, what about liability for any injuries or reactions as a result of the vaccine?
So in the United States, there's actually a federal program, a vaccine compensation program, where they have a whole group. They will evaluate people if they had vaccines, and if there was an adverse reaction, it would then go, they actually award money. That's something that's paid for by the federal government. That was developed many decades ago when a lot of the manufacturers were threatening to stop produce vaccines in this country because of the threat of lawsuits. But I can tell you at Henry Ford that the reactions I've seen, no one died from it. No one wound up admitted to the hospital in the ICU or anything like that. So I do want to stress, I think this is a very safe and effective vaccine.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.